Righto, good afternoon everybody. Quite a lot to get through today. First of all, we've got some good news around vaccine deliveries for August, which I'll share with you in a moment. We'll cover off the usual vaccine numbers update. We've got some information about our first mass vaccination event coming up in Auckland, and I'll also speak to this morning's announcement around saliva testing. You'll see that I'm joined today by Megan Main, the Joint Head of Managed Isolation. Our managed isolation teams in Auckland and Christchurch have worked particularly hard this week as they've adapted very quickly to all of the logistics required around managing return flights from New South Wales. And here in Wellington, the crew of the Viking Bay have also been supported by MIQ in what's a particularly difficult time for people who are a long, long way away from home. So a big thanks to the teams across New Zealand for their work around managed flights, particularly over the last weekend when they were having to move at great speed. I'm delighted today to report that our vaccine delivery schedule for August has now been confirmed. Pfizer will deliver more than 1.5 million doses of the vaccine into New Zealand during next month. That represents our biggest monthly delivery to date. It does align with our scale up of the vaccine rollout, and it's fantastic news for the overall program and of course for New Zealanders who are awaiting their vaccines. With those numbers backing us up, it's really important we offer people the opportunity to be vaccinated in as many different settings as possible and at as many different times as possible to make the vaccine as easy as possible for New Zealanders to get. And so one of those options that we have are mass vaccination events designed to get a large group of people vaccinated quickly and efficiently and of course safely at a single time at a single venue. Today I can confirm that the first mass vaccination event will be held at the Vodafone Event Centre in Manukau on Friday the 30th of July, from Friday the 30th of July through to Sunday the 1st of August. It's being coordinated by Auckland's 3 district health boards, supported by the Ministry of Health, and we're aiming to provide vaccinations to over 15,000 people across those 3 days. It will be open to staff and students from MIT, the Manukau Institute of Technology, and their whānau. So many students, staff and their whānau live in at-risk communities, so that is why we chose that location for our first big event. Inviting people from the MIT community to get vaccinated at this first event does mean that some of the people who are in Group 4 will be getting access to vaccination slightly ahead of the rollout for their age cohort. We're asking these people for their help in encouraging older and more at-risk members of their whānau to get the vaccine so that their community can be more protected from COVID-19. At the time of booking, they will also be invited to book in their second dose at another mass vaccination event that will be held at the same location in 6 weeks after the first. We've got sufficient vaccine stock to run this particular event without that having to disrupt the wider rollout plan or without having to in any way reduce the allocation to district health boards. We've got mass vaccination events, of course, are just one of the ways that people will be able to get vaccinated, along with community sites, some GP and pharmacies, pop-ups, and of course workplace vaccination, which we'll also be rolling out. We'll have more to say about the different vaccination opportunities in the coming weeks. So quickly now to run through the figures that we've released today. As of midnight last night, we've administered more than 1.4 million doses of the Pfizer COVID-19 vaccine across New Zealand, an increase of more than 133,000 doses from last week. The overall totals are 839,000 people have now received their first dose, and 564,000 of those have received their second. We're continuing to make good progress in Group 3. More than 400,000 doses have now been delivered across Group 3. Overall, district health boards now track around 6% ahead of plan, down slightly on previously, accounting for the fact that for a few weeks there they were making sure that they were sticking to the plan as vaccine supply was constrained, and we expect that the rollout will now continue to ramp up again as those bigger quantities of vaccine arrive in the country. Finally, today I have made a further announcement around saliva testing. We've today confirmed that all of our frontline border workers who are required to be regularly tested for COVID-19 will now be able to choose regular saliva testing as a full replacement for nasopharyngeal testing, that is the cotton buds up the nose. Saliva testing will be expanded as an option for all those on a regular testing cycle under the regular testing order. We'll start with those on the 7-day testing cycle, and we're aiming to roll it out to them by mid-August, and it'll be expanded over several months to include the rest of the estimated 13,000 people who are required to be tested on either a weekly or a fortnightly basis. The Ministry of Health's advice is now that saliva testing is increasingly viable and a reliable method for public health surveillance purposes. We'll still continue to use nasopharyngeal swabs as the primary means of diagnostic testing for those who are showing symptoms, but for surveillance testing, you can expect to see much more use of saliva testing, not just as a complement, as we were working towards previously, but actually as an alternative to nasopharyngeal swabs. Many of those workers are working on rotating shifts. They'll be able to access testing directly in their workplaces, the saliva testing directly in their workplaces, making it even easier for them to access. So the boost to the uptake of saliva testing as an option for those who do have to do it regularly, I'm sure will be welcomed by those workforces. The Ministry of Health has provided assurance that the selected saliva testing provider has the capacity, the flexibility and the experience to provide that service from mid-August as part of the complementary testing regime alongside nasopharyngeal for those who don't want to have saliva testing more regularly. Public health science and clinical advisors will continue to monitor and regularly review our approach as we undertake a phased rollout of saliva testing to make sure that it is delivering the outcomes that we are looking for. It will be a useful new addition to the toolkit. With that, I'm now happy to open up for questions.
The Ministry of Health has so far been reluctant to say that it's good enough to replace nasopharyngeal PCR testing, and now they say it's okay.
That's right. So the advice that I got about a week ago from the Ministry of Health was that they're now confident that it can be used as an alternative to, rather than a complement to, nasopharyngeal testing. So previously we had been indicating that those who were on a weekly testing cycle could move to a fortnightly nasopharyngeal swab in exchange for doing more regular saliva testing. The Ministry of Health have now provided advice that they are confident that actually it can be used as an alternative to a nasopharyngeal swab, which means people won't have to have them. The feedback we had, whilst we only had the saliva testing at this point available in a limited number of sites, the feedback that we did have is one of the reasons we were getting quite low uptake at those sites was people felt that if they were having to do the nasal swabs as well, they weren't getting any real benefit from doing the saliva testing. So now that it is an alternative, the feedback we've had from those workers is that there'll be more enthusiasm for it. And we're also expecting that the rollout to a much larger number of sites will happen quite quickly over the next few weeks, so that by mid-August we're available in a much bigger number of sites.
Has there been any sort of data or paper or research that has changed the Ministry of Health's decision on that?
The technical advisory group that the Ministry of Health do rely on for advice have changed their advice. They review all of the international evidence and advice all of the time, and their advice to the Ministry and therefore to us is that actually it can now be used as an alternative to, for the purposes of surveillance, it can be used as an alternative to nasopharyngeal swabs. Their advice continues to be that for diagnostic purposes, i.e. if someone's got symptoms, that it's still best to use the nasopharyngeal swab just to be absolutely assured that we're getting the best possible testing for them.
The Ministry has been criticised that they've kind of dropped the ball and been too slow on recommending that as a replacement of a nasopharyngeal PCR test. Is your view that they dropped the ball at all, or has that been an obstacle in not more uptake happening sooner of saliva?
I would say that they have been cautious, but I obviously welcome their new advice, and I welcome that reassurance that it gives us.
You're comfortable with the advice you've been receiving from them? You don't think that they've been...
I think we certainly acknowledge, and the Ministry of Health themselves acknowledge, that we're going to need to move a bit faster as new testing technologies become more readily available and become more reliable, and that will happen. I think when we get to the point where we can get a really good, reliable point of departure test, which is an instant test rather than one that has to be processed in a lab, I think we do want to be in a position to be able to investigate that robustly to make sure that it's good, but also be a slightly faster adopter of it than we might have aimed to be in the past. So the technical advisory group that the Ministry of Health has in place are certainly aware of our appetite to move more quickly when we can, but we don't want to move to new testing technologies if they're not reliable. But the technology around more rapid testing is certainly evolving very quickly.
In particular, Ecoscience has said that you have been poorly advised by the ministry. Do you think that's the case?
Look, I understand that there will be providers out in the market that will certainly be, promoting their products, and they'll be proud of their products. They've been doing a lot of research and development, and I have no criticism for them of that. But of course, we do rely on our technical advisory group to provide robust and impartial information rather than advice on a particular product.
Can you give us some more details about this mass vaccination event that's planned in Auckland? Like, how many vaccinators are you going to have there on site? And do people just sort of rock up, or do they need to walk over that 3-day weekend?
There will be a heavy emphasis on bookings rather than walk-ups for the first one. As we get further on through the year and we get to the point where we're going to be standing up more of these, it may be that more walk-ins are provided for through the big events. But this first one, we certainly wanted to try and get book-ins. So invitations, we're using MIT because there's a good population there that we can send invitations out to. And when they are invited to book in, they'll be invited to book in their families as well, which of course will expand out the group to a bigger number. And so we're confident that we want to use the capacity. We don't want people standing there, capable of vaccinating 15,000 and not having sufficient demand. But we also don't want it to be massively overrun either. So therefore, given it's the first one, the emphasis will be on bookings. That may not be the case as we do more of them as the year progresses.
How many vaccinators will you have here?
Well, enough to do 15,000 people, so about 5,000 people a day. So it will be quite a lot of people. There'll be hundreds of people working there. I can't tell. I haven't got the staff breakdown. But to vaccinate 5,000 people in a day, it will require a lot of people, because it's not just the vaccinators. You've then got to have the people who are signing them in, the people who are marshalling the car park and doing all those other things. I'll let you finish that, and then we'll
have other
move to
locations in mind at the moment to do more of these events.
Naturally, South Auckland is an area where we do expect to see a focus because of the nature of the population there, the exposure to the border. South Auckland is a logical choice for these kind of events. But other population centres where there's a density of population, I think you'll expect to see those. So the big cities, certainly, potentially in some of the smaller, more provincial areas of New Zealand, we've got the ability to, or we will have later in the year, the ability to use these kind of events to top up our vaccination rates, if you like, if we feel that there are areas where perhaps the vaccination progress has been lagging. So we'll keep that in the toolkit. But we want to make sure with this first one that we test it, that we get all the systems right. We were going to do this earlier. We delayed it because of the vaccine supply constraints that we had. So this very much is the prototype event.
Do you need to have another event 3 weeks later, basically, to get everyone?
Yes, it'll be about 6 weeks later. I think that's based on a variety of things, venue availability, staff availability, and so on. But certainly those people who are booking in for their first will be encouraged to book in for their second at the same place.
So the idea is they wouldn't do that and then go to a GP right afterwards?
No, that's right.
How many people have you found who have arrived in New Zealand who haven't had a pre-departure test since you introduced that requirement for a pre-departure test for all trans-Tasman flights?
It's look, from memory, it's sort of in the 20 to 30 range is what I've been told of so far. I have asked for more advice about what more we could do just to add extra rigour to that process. So we're looking at sending. We have what are called airport liaison officers based at the main airports in Australia who can supplement the test or the checking that's done at check-in. One of the things that we have to remember about trans-Tasman travel now is it is a much, much more automated process than it has been previously. So people will typically be checking in online. When they get here, they'll be going through SmartGate rather than presenting to an individual person at the border. And to introduce more manual processes significantly adds significant extra cost and also significant extra time to the process. So we're looking at all of that at the moment. I'm not taking anything off the table. If we end up having to close SmartGate and make everyone go and queue up again and go back through a manual process because we're not confident that we're picking up or people who are trying to evade the testing system. I certainly wouldn't rule that out at this point. But that would require recruiting and deploying very quickly a whole lot of extra staff.
Those who have been caught so far, though, is there a feeling that they're actually trying to evade the system, or is it more they didn't realise they needed to get a pre-departure test or the wrong type of test?
You see a mix of different things. I think sometimes there are people who maybe were just a bit confused, and we do see some people who were deliberate in trying to avert the system. We have sent some people straight back, so basically turned them around and sent them back on the next flight back out of the country. Or they've spent, if they're New Zealanders, then they've spent 2 weeks in our managed isolation facilities, which they will be charged for, because if they're not eligible for the exemption, because they're not complying with the rules, then they'll be charged.
As of last Friday, you were checking 50% of people roughly on this side, and Australia was checking roughly 10% of people on their side. Are those numbers still relatively consistent now, or have you changed that?
No, so, well, it varies by airport and it varies by surge workforce, if you like. So with Melbourne, when we did Melbourne, I haven't had the most recent numbers from some of the others, but when we introduced this through Melbourne, the checking rate in Australia was significantly higher than 10%. They basically said, look, we'll check a minimum of 10%, but it actually got much higher than that. We will, and the airport liaison officers there, we're increasing the number of those, and so that also increases the layer of checking, but I don't have the exact numbers.
Just back on the mass vaccination in these venues, yes. Has the government had to pay to book these, or have the companies just offered these to you free of charge?
Sorry, is the venues?
The venues, so you said it was the Vodafone centre, wasn't
Yeah,
it?
I'm assuming we're paying a venue fee for that. I don't have that information.
Do you have any information on what the government's budget is between now and the end of the year for those sort of bookings?
Look, we have quite a large budget for the vaccination campaign overall. I didn't bring it with me, but it is a very large budget, which includes buying the vaccine and paying all the people to administer the vaccine, and if venue hire is required, and it will be undoubtedly required in some places. Some people may, out of the goodness of their hearts, allow us to use their premises for free. Certainly for workplace vaccinations, where we're doing workplace vaccinations, I wouldn't expect that we're paying for the privilege of doing that, given the service that they're being offered. But there'll be costs associated with that as well. Happy to come back to you with some more detailed breakdown about that.
Why did you choose 6 weeks later? Because the optimal time, is it not 3 weeks after your first vaccination, have your second out? Is there going to be changed advice around that?
No, it's a minimum of 3 weeks. So you can't get your second dose any earlier than 3 weeks after. And that's generally the guidance that we work to for people who are self-booking. In reality, most people are getting their doses. I think the average gap between doses sits somewhere around 24 days, which would mean that most people are getting their second dose within about a 3-day window of their 3-week anniversary from the first. But the health guidance suggests that while 3 weeks is optimal, there will from time to time be reasons why it's longer, including sometimes logistics. So I understand in this particular case it was logistics, venue availability, staff availability, that meant that it was 6 weeks. 6 weeks is still a very healthy and acceptable gap between the vaccine doses.
So on trans-Tasman travel and a bit of confusion, a bit of a curly question about a specific situation. There was a woman who travelled here from Melbourne this Monday. She spent last week in Queensland, and after she was asked about that, she was taken from Wellington Airport to MIQ. She spent a day there, and then she was taken out of MIQ, released, taken back to the airport so she could fly to Brisbane, so that she could fly back to New Zealand, and then once she got to the airport, she was turned back around again and taken to MIQ. Do you know what's gone wrong there?
I don't have the exact details on that. I'm not sure whether, Megan, you have the details on that?
Thanks, Minister.
Yeah.
I don't have the specific details on that case, but what I can say is that if someone arrives in New Zealand and they don't meet those quarantine-free travel requirements, immediately that triggers them being under the air border order, which means they do come to MIQ for 14 days. And the only exceptions to that are where a medical officer of health makes a determination. So that's a generalisation in response to the specific.
Yeah.
Jean been clear enough, because she said she was only in green zones in Queensland, so she thought she was totally okay to come here.
Look, it's difficult to comment on a specific case without knowing all of the details of it, so where they were and all of that. But generally, I think the advice given to people travelling from Queensland has been quite clear. It's certainly all available on the COVID-19 website for anybody to look at.
We're hearing of a lot of cases of people showing up at the border and then not actually being eligible for quarantine-free travel and having to go into MIQ.
Like I said, from memory, from what I've heard so far, it sits in the sort of 20 to 30 range. And those people have, as I said, where possible, they've been turned around and sent back. Some have gone to MIQ. I'll let you add anything to that if you want.
Thanks, Minister. There's a few different ways people can breach the quarantine-free travel order. One is to not have the prerequisites such as a pre-departure test, and the other way is if they've actually been in New South Wales and come in. So I think, from an MIQ point of view, we've got 60 people in MIQ at the moment who we call border averters or who have breached one of those requirements. Those people are being taken in as part of our contingency. It's not what we necessarily, want to use the contingency for, and we're certainly working really closely with other border agencies and the Ministry of Health to get as much information out to travellers before they leave Australia to make sure that they know what is expected of them on arrival here in New Zealand.
Is the message being clear enough? Because there have some people who have, there's that, if you've been in New South Wales since the 26th of June, then you might have to go into MIQ, but that's only a message on the health website. It's not on the COVID-19 website. There have been travellers who've come in from Queensland and been sent to MIQ, and they weren't aware of that caveat there.
About being in New South Wales?
Since June 26th, yes.
Look, I think, we've mentioned it many times here in this particular press conference. I think it is incumbent on people to make sure that they understand the rules that apply to them. If that information is not on the COVID-19 website, I'm happy to go away and check that. I'm certainly been clear on it in all the comments that I have made, so we'll go back and check if there's any inconsistency in the information that's being provided there.
The mariners off the Viking Bay, did they undergo pre-departure testing?
I'm not sure.
I understand. I don't know when that would have been. We have been involved in them since they were in New Zealand waters. So,
perhaps I should clarify here. With international ship crew changes, New Zealand is basically just facilitating people landing at an airport and being transferred to a ship. Our focus is on making sure that that is as smooth and safe as possible, and you'll see that happened very smoothly here. So everybody who they interacted with was, fully protected, fully vaccinated, and a lot of protective measures were put in place there. We made a decision several months ago that where these crew changes were happening, we would test people, even though they were often here for less than a day. They were here just literally landing and transferring straight to a ship and then out again. And the reason that we wanted to test them was if we then found that we had an unexplained COVID-19 infection that we couldn't link to the border, it adds to our database of potential cases that it could be matched to. And so that's the reason why we were doing the testing. In this case, there was no extra area of concern for New Zealand on the New Zealand side, but we became aware that they had positive COVID-19 people on board. It's now subsequently proven that spread quite quickly through the ship, and so there were a number of people there that needed extra care. And as a good global citizen, New Zealand had a ship close to us that needed extra assistance, and we have provided that. I would certainly expect that if it was a New Zealand ship somewhere else around the world, that other countries would do the same for us.
If they're landing here in New Zealand and being transitioned to a ship, should they not have been tested before they flew here in the first place?
Look, I'll have to check the pre-departure testing as to whether there's any... people coming from red zone countries do need a pre-departure test. I just have to check whether there's any technicality that exempts people who are transferring directly to a ship. I don't have that information with me.
And can you please clarify for me how many exactly of all those crew members have the Delta variant?
My understanding is that is the infection that they have. Yes. I haven't got the genome sequencing for all of them, but I'm aware that Delta, for those who have been genome sequencing, my understanding it is the Delta variant.
Are you confident that the Grand Mercure is the right place for having 15 positive cases of COVID with the Delta variant?
I'll hand that one to you.
So we have confidence in our people, our workers are the front line against COVID. We're giving the workers the support they need. All of our facilities treat every arrival as if they have COVID. We've had 152,000 people through MIQ around the country, roughly 1,000 positive cases. So this is our job as MIQ to look after these people. We're making sure that we're giving all the support we can to both the returnees and the staff, because this is a reasonable number to have come in at once. but all of our normal protocols are in place. And in addition, just to make sure that we're doing everything we can, we've had an additional infection prevention control review this morning to just make sure that there isn't anything else we can do to support those people. But this is our job.
I can confirm, I have just looked it up, I can confirm that they did all have pre-departure tests before coming to New Zealand.
Why have you not spoken to anyone from Pfizer?
Look, we made the decision that given the significance of the Pfizer to our rollout campaign, that the direct communication with Pfizer should come from the most senior level possible. In New Zealand, that's the Prime Minister. And so the Prime Minister has been in contact with Pfizer. Where there's been a need to contact Pfizer directly, the Prime Minister has done that.
No communication though before February, before the advance purchase agreements were signed. Is there a perception there that we haven't lobbied as much as we could have to get doses as quickly as possible?
Look, I mean, let's consider this in context. Up until January of this year, we were working to a four different vaccine campaign, different types of vaccine campaign. We made the decision in late January to switch to using Pfizer based on Pfizer's indication that they could make those doses available to us in the second half of the year. Once that was through the negotiating process, the Prime Minister then had conversations with Pfizer about exactly what the delivery schedule would look like, made New Zealand's position very clear on that, and that's where the conversations have subsequently been.
You're satisfied?
Well, I'll let you finish that one.
You're satisfied that we've gone hard enough to try and get as much as...
Absolutely, yeah.
Just going back to the MIQ hotel where the Mariners are being held, can you please tell us where exactly the exercise area for COVID-infected people at that managed isolation hotel is?
We've got separate, segregated exercise, fresh air and smoking areas for our quarantine returnees, quite separate to the isolation returnees. So they're physically separated, separate lifts, separate workforce, so that there's no crossover.
Is it the car park beneath here? Is that the exercise area?
In that facility, most of the outdoor space is within and next to the car park, yes.
When Cabinet returns in early August, is that when you expect to be able to make a call on extending Pfizer out to 12 to 16-year-olds?
Yeah, I think as the Director General commented when we were asked about this last week, we're still just looking at that information around potential heart inflammation amongst younger recipients of the vaccine, and we're waiting for further information about that before we make a final decision on those 12 to 15-year-olds.
What about the Johnson & Johnson vaccine? Will you be expecting to be able to make a decision on that relatively quickly in August as well, or could that be months out?
That's, I think I indicated previously, we'll make a decision in August around when and where and if we would use that vaccine. And part of that, of course, will be hopefully having a confirmed indication of when they could deliver them to us by that date as well. Now, just before I take more questions, I realise that there was something that I didn't raise earlier, and you may well have questions about this. Today, the Ministry of Health is issuing 16 infringement notices for $300 fines to border workers who have not complied with testing under Schedule 2 of the required testing order. Those infringement notices will be emailed or posted to those people. Prior to the infringement notices being sent, many attempts have been made by the Ministry to contact these workers to provide them with support and assistance to comply with the required testing order, including being provided with testing opportunities, providing reminders and giving them a formal warning. Those who have not complied with those requests, 16 of them are now being fined, and I expect that there will be more of those if people continue to not be tested as they are required to be.
Are they
private?
Are they keeping their jobs?
What was that?
Are they keeping their jobs?
Yes, they are, but they are being fined.
Are they private or are they government employees?
My understanding is that they are, I don't have a breakdown of exactly where they work, but I don't expect them to be government employees.
If you had a choice, would they still have their jobs? Or is that something that you have?
That's something for their employers.
Of MIQ?
Was that?
I would expect they're not MIQ workers.
That's my understanding.
The terms of use for the MIQ allocation system say that if you use any automated software that you're violating those terms. Do you intend to actually enforce that rule and stop these sites that are charging people $2,600 a pop?
So when we talk about these software solutions, these bots, what we mean is auto refreshers, alerts, auto fillers of forms. The bots don't make bookings, and so these auto refreshers still require an individual to be there to make the booking. Our terms of use require a user to not share their login details with anyone else. So it's the user who's not complying with the terms of use. And where we identify these, we do stop them. We do block them from using the site. What we encourage is people to follow our terms of use. But these refreshers do not actually make the bookings for people.
The systems, though, that make these bookings within a fraction of a second, that's not a person doing it. That's an automated system. I've spoken to tech experts who say this distinction you've drawn between these systems and bots is a false distinction. All of it, that it's the same thing.
So you still need to physically have a person doing the second recapture to finalise that booking. These refresher sites, these auto fillers can help, but they can't finalise the process. You can't go off and get a coffee and let your refresher do the work for you. And what we're doing this week is making a change. We're constantly making changes to make the system as equitable as possible. And this week we're making a change so that each time you refresh the page, you don't need to refill your details for that booking. So that makes it faster for people to finalise their booking. But at any one time, there can be thousands of people trying to get these places. So they will go quickly. This isn't a system problem so much as a demand versus supply problem. And there's a reason that our supply is limited, and that's because we've got to keep this system safe. So we don't have unlimited capacity in MIQ. For us, it's our 31 facilities. And so what we're trying to do is make it as equitable as possible. But when demand equals supply, we've looked at a lot of different options, various things that we're working through to see if they will help Kiwis overseas. And we get to looking at things like, the US green card lottery, various types of wait listing, alerts. So we're very focused on trying to keep the system able to support people, but ultimately demand is exceeding supply.
Kristen, up the bit.
Yeah. Why not just have a wait list? It's been a race as to who can click the fastest for at least 6 months now. That's not an equitable system. Yeah,
there is no silver bullet. So we've made changes to the system to make it more equitable, and we'll keep doing that, and we'll keep looking at where a wait list might help, whether it's for a subset of people or beyond. We'll also look at alerts for different classes of people, but we just need to be careful that we keep the system stable as well.
If you've been looking at a wait list for quite a while, that would eliminate the need for people to be at their computers all night refreshing. Why not bring that in?
So if we go back a couple of months, in April and May, we had available rooms through to September. And so then we had the balance the other way, where supply exceeded demand. The complaints went down, people were able to get the dates they wanted. So what we've moved back very quickly into, much earlier than we did last year, for example, is a situation where again, demand is exceeding supply. And so we just need to keep working on that.
Already answering the question, though. The question is, what is the argument against a waitlist, which would clearly be more equitable? I mean, supply and demand, sure, that's an issue, but to say straight-faced that it's not a system issue with all these reports of people paying thousands of dollars to try and get a spot at all, it's difficult to say with a straight face, sure.
So one of the challenges with a wait list, as with any wait list for anything that you sign up for, is it pushes the problem further up the pipeline, if you like. So what we don't want is a lot of people who don't need vouchers anymore because their plans have changed, staying on a wait list, which means that people appear to be sort of waiting months for a voucher. Ultimately, we've got the capacity we do. Last month, we had almost 8,000 people through. Since MEUS went live, we've had well over 100,000 people use it. And we will continue to try and improve it, but we do have a challenge right now. And it wanes and waxes in terms of demand versus supply, but right now, demand is high.
Come over here.
So the New South Wales bookings, it seems like people just had it linked immediately to their flights. So if they got a ticket on a plane, they had a data space in MIQ. why not try to extend that out? Lots of the flights coming to New Zealand are from Air New Zealand. They're an airline that the government has a good relationship with. Why not link the flights more closely across more MIQs, so people can say, look, all I have to do is try to get a ticket in, and if I get a ticket through this airline, then I'm guaranteed to have an MIQ room. Wouldn't that make things much easier?
So I appreciate the Minister's acknowledgement up front that it's been quite a busy time for everyone across the border agencies and MIQ included in setting up this New South Wales managed return process. But this is not a normal, it's not a normal red flight process, and it's not a normal green flight process. We've set up a new process for managed returns where we are literally directing to airlines, Qantas and Air New Zealand, how many people they can put on a plane, on what date and to what city. We can do this for a short period of time, and that enables us to fill some of the rooms that would otherwise be unable to fill because of our cohorting. Our cohorting is put in place as a public health measure, as a very strong Swiss cheese slice, but it does mean that once we close the door after we've filled a facility for 96 hours, we can't then keep topping it up. What we've used in this 2-week period with New South Wales is a process where, with the airlines agreement, we're topping up those rooms in that 96-hour period across our network. It's quite complicated. It's involving hourly conversations with both airlines. If we think more globally, we've got people coming from all over the world back to New Zealand all the time through hubs with many airlines. They are commercial organisations. This is sustainable for a short burst, but not as a long-term solution.
If I could perhaps just add, regardless of how you do booking allocations, there'll be strengths and weaknesses of different approaches. So we could move to a system where the government determines who can come in by allocating a set number of places to each airline, for example. We can have an on-demand system like we do through MIQ. We can have a waitlist system. Every one of those different systems has strengths and weaknesses, but we have to recognise the fact that whatever system we're using at the moment, demand is outstripping supply. There is a reason why I stood here several months ago and said to New Zealanders who need to come home to New Zealand, now is good. It's because we had space and because we knew that there was a likelihood that at some point in the future demand would once again build to outstrip supply. We've reached that point quite quickly and certainly earlier than we had anticipated reaching it, but it was New Zealanders abroad wanting to come home. We were forewarned of that potential quite some time ago.
On reconnecting with the World Health Organization obviously has the 60 to 70% target for vaccinations to achieve herd immunity, and a number of growing countries are now reaching it. Israel, Iceland, Chile. When will New Zealand, do you think, reach that target?
All of the advice we've had from epidemiologists is that actually you shouldn't set a target in terms of what level of population coverage you want to get for the vaccine, that aiming for anything less than 100% is aiming for failure. Now, of course, we don't expect that we're going to get to 100%, but we're not going to aim for anything less than that.
Not a target, though, then, like an estimation on when you will get to that point.
Look, we will offer everybody the vaccine by the end of the year. That means 100% of New Zealanders will have the chance to be 100% of eligible New Zealanders, depending on what happens with the age cohorts, will have the chance to have the vaccine by the end of the year. Those who don't, we will have provision in the new year for them to still be offered the vaccine in the new year. And of course, we're making preparations for potential booster shots as well, should we need to have that. So we're going to be doing this for a wee while yet. But I'm not going to give people who are perhaps receiving misinformation the out of saying, well, I'll just be part of the whatever percent it is that we're not aiming to have vaccinated. We're aiming to have everybody vaccinated, unless there's a health reason why they shouldn't be.
In this reconnection debate, revisiting Ardern's previous statements on it, she said that at this moment right now is when we will be considering other bubbles with other countries that might have it in a similar situation. Is it right to think that no other candidate country has come up except for potentially UA in this moment? There's no one else on the government's thinking?
Look, I'm not getting into the reopening conversation today. We continue to keep things under review. We have been building up our overall public health assessment capability because this is going to be an ongoing pressure for us. We're going to have to keep assessing countries around the world and assessing where the highest risk is, where the low risk is. We've been building up our capability to do that. We've been collecting more regular data from all of them, recognising that some countries actually, one of our challenges is we just can't get data about what's happening in those countries to really genuinely assess the level of risk within those countries. Our capability there has grown, it is getting better, But at this point, I'm not going to give you a list of, who we think are more likely to be heading in the green direction versus those who are heading in the red direction.
Really quickly, with your Minister of Education hat on, unless anybody has any. Go to Mark first.
We'll finish up COVID and then we can do a quick education question because you're lucky. Yeah.
You mentioned preparations for possible booster shots. What does that look like? What work is being done?
At this point, we don't yet know the confirmed timetable. It could be somewhere between 8 months to a year later after having your second shot that you need to, the recommendation is to get the third shot. At this point, we still don't know whether that's actually what we're going to need to do. So we're preparing for the potential for that to happen. We will certainly have enough supply this year that if the advice is, say, 8 months, for example, we would have enough supply to be able to to provide people with a third shot 8 months after their second one. For those who got vaccinated within that timetable, we would need additional supply next year in order to be able to keep that going. But at this point, we haven't made decisions on that, but we're preparing for that eventuality if that's indeed what happens and if that's what our health professionals in New Zealand recommend that we do. Did you finish that?
The DHB plans for how many people they want to vaccinate ran out essentially on July 4. They haven't put up new ones yet, at least not with a sort of long-term view for the next couple of months. When do you expect to see those plans put in place?
We should be able to get stuff out within the next little while, around sort of between now and August. Now that we've got that confirmed allocation of what we're expecting between now and the end of August, we should be able to do something more on that.
Are we talking? Yeah. On AstraZeneca, what's the? Do you have an update on that? There was a bit of confusion around its process this morning. Is it not quite important that that get put through quite urgently with the situation of Fiji at the moment?
AstraZeneca is still going through the full MedSafe process. As I've indicated to you before, the fact that another country's approved the vaccine doesn't automatically mean that we approve it here in New Zealand. There are different things that different countries will consider. One of the things for us with AstraZeneca is that our vaccine supplies are likely to be manufactured in a different plant to Australia or the US or other countries who have previously approved AstraZeneca. So that's one of the things going through the approval process. I do understand it's getting close, but I just don't have an absolute locked-in timetable for that.
And on the New South Wales situation, how much support requests has the government been given? There's a lot of people still stuck there, probably wanting to come back to New Zealand. Is it quite high?
My understanding is that there is a very steady stream of people seeking advice from MIQ, consular advice from airlines. Those call centres are working very hard at the moment to provide guidance and information to those people. Some people in New South Wales will be waiting a while before they can get a flight home to New Zealand. It does fall into that buyer beware or flyer beware category that we talked about before, that people could find themselves staying in Australia for a long period of time in the event that there is a disruption to the Trans-Tasman bubble, which there is at the moment.
Is Wellington Hospital treating anyone off the Viking Bay ship or preparing to treat anyone?
I don't have that information, sorry. I'll happy to follow that and come back to you.
We're supposed to get 1 million doses of the Pfizer vaccine this month. Are you able to just say how much we've already received and if we're on track to receive all 1 million doses of the vaccine?
Yes, we are on track. As I indicated previously, though, the doses in the first couple of weeks sit more around the 150 mark, and then they get bigger in the second 2 weeks of July. So we haven't had the first of the big ones yet. That would be next week.
Australia's signalled it's getting a big batch from Pfizer earlier than expected. Any chance that we'll get the same thing?
Look, we keep talking to them all of the time. Yeah.
The vaccination rates for Māori per capita are still lagging well behind other groups, and the gaps appears to be widening. I guess, how concerned are you about that? And obviously it's been flagged for quite a while, this gap, and the fact it's widening. I guess, what more are you doing to address that?
I think, as we canvassed before, if you look at groups 1 and 2, Māori and Pacifica New Zealanders are disproportionately underrepresented in groups 1 and 2. So there are fewer of them in the health workforce, there are fewer of them working in some of the parts of the border, and therefore that's reflected in the lower uptake amongst Māori and Pacific so far. We do want to see those overall rates start to get closer to their proportionate share of the population as we move our way through Group 3. It is one of the reasons why we've chosen South Auckland to be our first site for the big mass vax event, because we know that there is a high concentration of Māori and Pacific people living in that community, and we'll continue to lean into that. We're working with Māori and Pacific health providers to make sure that we're getting vaccination rates up higher in those communities, and we'll continue to do that as well. Am I satisfied with those rates? Not at all. We're going to need to really do better amongst our Māori and Pacific communities.
It's about 40% difference. Is that what you would expect at this stage, and for it to still be increasing?
The fact that it hasn't budged much as we've gotten further into Group 3 is a concern, and so that is something that we will look at. Last COVID question up the back here.
Just to be clear, the main argument against a wait list for MIQ vouchers is that people who no longer needed vouchers would stay in the wait list?
That's one of the things we need to consider. I wouldn't say it's the only consideration.
Why not just have an option to opt out then if you don't need a room anymore?
What we see is once people's plans change, they can forget to do that. So we have that now with our vouchers. We follow up with people to make sure they still need them. As I say, there's a range of things we're looking at. Clearly, demand has exceeded supply quite earlier in the season, if you like, this year than last year. And so we're working through those options.
I'll let you have your one cheeky education question.
Sorry, there'll always be the supply and demand issue, but surely you have access to the best and brightest minds in the technological world. Why is this system still so inefficient?
Consistently, the answer is there is no silver bullet. It's a range of levers that we need to use, both within the system itself, but also in the behaviours, the communication to people, and those human processes around it.
Yeah.
On behalf of a colleague, why was an Auckland mother told she couldn't continue paying for her autistic son's teacher aid?
So look, I'm looking into that at the moment, but I think one of the, I understand one of the issues there is that the school are issuing an invoice to the family. Schools aren't allowed to issue invoices. That doesn't preclude parents entering into a voluntary arrangement to pay for something extra for their kids, but they can't be issued invoices because that would be contradictory to our law. Our law says kids get a free education. If parents, and particularly around teacher aids, want to negotiate, and I'm aware that many do, to pay extra hours for that teacher aid and they're paying that, then they can do that, and they do that, but they shouldn't be invoiced for that. So I haven't got all of the details. I've only got some of the details so far, so I'm still looking at that.
And did you ask your officials to call the school and instruct them to tell the mother that she couldn't keep paying for the aid?
No, that's not an instruction that I have given. I haven't given any instructions about this particular case at this point. I'm still looking at the details of it.
It's equitable, really, that anyone can pay extra for a teacher aid, and that should just be provided by the state. Doesn't that go against the spirit of the law, which is that education is free for all according to need?
Ultimately, we make the Ministry of Education, with the clinical psychologists, the educational psychologists who make the decision, will make a decision based on the number of hours of a teacher aid time that a child needs in order to be able to participate fully in school. Some parents will indicate that they disagree with that assessment and that they think their children need more hours, and that they are happy to pay for that. And I'm not going to say that they shouldn't do that, but I'm aware there's a lot of pressure on the teacher aid hours that are available. And so if parents are contributing more, that eases a little bit of that pressure. Do I think we need to do more in that space to increase the overall number of hours of teacher aid funding that are available? Absolutely. And you'll see in every budget that I have been Minister of Education, we have increased funding in this area. Have we reached the utopia where there are enough? No, not yet. All right, thanks everybody. Cheers.